My name is Maria, and we're coming to you live from the Kenya Institute of Primate Research, where we want to talk about pertinent issues touching on the health sector. That is from the Social Health Authority, SHA, to the recent vaccination campaign against rubella, measles, and also typhoid. And joining me in this exclusive interview is none other than Dr. Ouma Oluga. He is the Principal Secretary, Medical Services, Ministry of Health. Thank you so much, sir, for joining us.
Thank you. Thank you so much.
Karibu sana.
Asante.
Where do we start? Dr. Ouma Oluga. People remember you, Kenyans remember you as that vocal Secretary General for the Kenya Medical Practitioners and Dentists Union. But you've also held very many other portfolios, including the Director of Medical Services, NMS, the Nairobi, Metropolitan Services. So congratulations, first of all, for being appointed the Principal Secretary of Medical Services. Yes. Yeah.
Thank you so much. And then good morning to our viewers. First and foremost, I think I've been privileged in my life to have opportunity to work. As you've noted, Kenyans remember me for that position I held, leading doctors. And then I also even led the health workers globally. I know for 2 years, 2019-2021, I was the co-chair of Health Workers for All Coalition, which is a global organization. And in that space, of course, we pushed for a lot of reforms in terms of how health workers are treated. There is no single health worker in this country who is earning a salary that I did not negotiate, not a single health worker.
Okay.
So all the salaries that health workers earn, I negotiated them. And we were doing it, I think it's good to put it into context, we were doing it so that every Kenyan, irrespective of where they are, have access to a skilled, motivated, and supported health worker. We were not doing it because health workers are special, or because they are well-educated, or because they are deserving jobs. I am extremely passionate about healthcare, extremely passionate, and I'm very grateful to His Excellency the President for giving me the opportunity now to serve in this position, because I have always longed in my life to make a difference in our healthcare system. Early on in my career, when I was in the university, I had the extraordinary opportunity to travel so many countries within Africa and outside of Africa. I did my attachment in the United States of America when I was barely 23 years. I was in Oregon, Portland, Providence. I went to Egypt when I was still a medical student, was there for another 2 months trying to look at Suez Canal University, how do they do their systems. I had the opportunity to engage in South Africa, and so I saw very many systems all over the world. And so it sparked a fire inside of me. How can we make our healthcare systems better? And then so kila kitu nafanya inakuwa to, like, I usually want our healthcare system to work, and especially to work for the person who does not have my number, the person who does not know an MCA, the one who does not know an MP, the one who cannot even call for Arambe because they don't even have a teacher in their family who they can call. Because that's the background I come from. I come from a very poor background that if systems did not work, then, I would not be here.
Exactly.
Yes, so that's the premise that I want to work with. And I carry that passion with me every single day in office, working for the common Kenyan.
Thank you so much, Dr. Oluga, for giving us just that brief, of your background and the experience that you've had, from university and the other, exposure, out of the country, and just seeing how other health systems work and wanting the health systems to work here in our country. But it's been just about, say, 100 days in office.
Yeah.
So, exactly.
It's 100 days in office.
Yes.
But that 100 days has meant a lot. That 100 days we have streamlined a lot. I think now people can see the unions are quiet. I am background is union. In fact, the first 1 week I was in office, I had a 30-minute conversation with PS Kipto, PS for National Treasury. And we were just going through the things that we needed to solve the workers' challenges. By the way, take it that that is not in my state department. But, you know, I need the workers in the hospital so that they can work for Kenyans, even though it is not directly under me, but I need them. So we have to solve that issue. And then I am also grateful for the Cabinet Secretary, because when I presented the issues to him, and he asked me what can we do, and we sort of packaged how we can work with the National Treasury. Now we've solved the CBA issues of doctors, the arrears have been paid, internship is done. Interns form 27% of the workforce. The younger doctor seeing you in a hospital is more likely to be an intern. Yeah, 3 out of 10 doctors are interns. So that's a big workforce that I need so that patients can be treated. You've seen the vaccination issues. The other thing, for the last 1 year, we had not procured vaccines in the country. So you could, when we came into office, the first letter I signed on the 17th of April when I came into office was 1 billion shillings that we were getting from Treasury. And again, thanks to Treasury, because we just made the call that morning and I was like, we're in a crisis. We need to sort out this. And we were sending that money to UNICEF. A few weeks later, you saw us receiving the vaccines at the airport.
And you know, Dr. Oluga?
And now, yeah. So, I mean, coming from, you know, we came in to sort crisis. So, the health workers crisis, the issues around vaccines crisis. People had missed some vaccinations for around 3 months. Right now, you don't hear of anything about vaccinations. All hospitals, public, private, have vaccines. We have received vaccines. We have vaccines now. We have even procured more. We've sorted our issues with Gavi. We owed Gavi around $12 million, around 1.5 billion Kenya shillings. And we were facing the risk of what we call red zoning. Red zoning means that Gavi gives us a lot of support for vaccine, but you have to pay your part. So by 30th of June, we were facing that risk. So the first crisis, health workers sorted. The second crisis, vaccine sorted. The third was to stabilize the systems and the SHA.
Okay.
And to make sure that things are working. As you can see, we have stabilized that. Many hospitals were complaining, or the systems, the OTP is dropping. Now, it takes only 1 second. You get your 1 second, you get back your what we call one-time password, you give to the health worker, everything is now okay. And we have progressed. By the time I was coming to office, we were just 21 million Kenyans who had registered. We are now nearing 25 million. We are around 24.8 million Kenyans that are now registered. So just in a span of 3 months, we can say that 1 million per month, which is quite a big achievement. You've, of course, seen, again, the support of the Cabinet Secretary. We've been going around to do what we call activations. So the 1 month in office has been good. I've also streamlined the State Department, you know, the Technical Directorate. We went in and, you know, we just wanted people to feel like they are motivated, they need to be aligned to work. And so we've done a lot of meetings with our workers in the ministry itself, and also with our state departments, state parastatals. We've seen us going to Kenyatta National Hospital, Jaramogi Oginga Odinga Hospital, Moi Teaching and Referral Hospital. We are with our KEMSA, I've even addressed staff there just to make sure that what we call institutional stability.
Exactly.
So that institutions perform, so that institutions are aligned to the government agenda. And more importantly, institutions are aligned to the public expectations. Remember when I came in the first day, I said 3 things. One is to restore trust and public confidence, you know, and then I'm glad that the CS also has picked that. So we are very aligned in our agenda. Number 2 is what we call implementation efficiency. Many times government has policies, they have goals, they have objectives. You know, when the president speaks about something, when the president speaks about Tifa Care, then people on the ground say, but we don't see that. That is because the efficiency of implementation. So what the president says, or what the policy is, what the law has been passed in parliament, how is it implemented on the ground? So we were trying to improve that implementation efficiency. And number 3 is to create order.
Yeah.
That means that there is some, you know, there is sector discipline so that people are not doing as they wish, which was the norm before.
Thank you so much for that brief. I mean, just you coming into office and ensuring that things are lining up, because you could have delved into why those bottlenecks were there, but that's a conversation for another day. So talking about implementation, SHA, it's been a big, can I say, problem, especially for Kenyans when it comes to access and all that. I know you've already said how you've been able to ensure that the OTP is, you know, something that they do not have to wait for long and all that. But there's still a little bit of, a lot of, not even a little bit, a lot of misunderstanding of what SHA, Tifa Care. What's the difference, Tifa Care and UHC? There's a lot of acronyms there. There's SHIF and all that. Maybe you could break down for us a little bit.
I know, and we take blame for that. There's quite a lot, and so the entire healthcare system, if you look at it, requires to be organized in a particular way. The way it is organized is what we call the UHC model. Now, our UHC model, the UHC is universal health coverage. Now, our universal health coverage, or the type of universal health coverage that we are doing, is what we are calling Tifa Care. Now, this Tifa Care, iko na miguu ine. It has 4 components. Miguu ine. Mguu ya kwanza ni how you buy healthcare, or how you can afford healthcare, or what we calling healthcare financing. Si ukienda hospitali unahitaji kutibiwa, lakini hospitali wanakuambia lipa kwanza. So how do you purchase healthcare? Hiyo ndio mguu ya kwanza. Money for health. Mguu ya pili ni how you get treated. So ukienda hospitali lazima upate daktari, lazima upate nurse, lazima upate, you know, huyo mwenye anakuhudumia, the health workforce. Hiyo ndio mguu ya pili. Mguu ya tatu ni saa ile umeenda hospitali lazima upewe dawa. Lazima ufanye x-ray. Hiyo ndio mguu ya tatu. Tunaita hiyo commodity security. Lazima upate hiyo x-ray hapo, lazima upate ultrasound, lazima upate dawa. Commodity security. Mguu ya ine ambayo ni important sana ni how the information flows. Sisi kama watu ambao tuko hapa idara ya afya, or in the Ministry of Health, how do you know that you went there? How do you know the medicine you were given? How do you know whether you got an x-ray? How do you know that how much money you paid or you asked to pay? So digitization. So digitization is supposed to give us all that data. Ndio Dr. Oluga akienda kwa hospitali, tumejua Dr. Oluga leo alienda hospitali, Dr. Oluga leo aliambiwa alipe shilingi 500 ama amelipiwa shilingi 500 na SHA. Dr. Oluga amepewa Panadol, Dr. Oluga amefanya x-ray. Hiyo miguu ine. Health financing, human resource, health workforce, commodity security, and digitization. Now, SHA just falls in one of them, the health financing. So the health financing is we want to make sure that everyone can go into a hospital, walk in and walk out without worrying whether they had money or not. Because ugonjwa haigongi hodi. Disease does not alert you that I'm coming tomorrow. It comes when it wants to come. So when you go to the facility, we want every single Kenyan to go into the facility without worrying how they will pay. Because you can't plan for a disease. That is why we have established the Social Health Authority. Now, the Social Health Authority is an organization. The Social Health Authority is the same as KRA, is the same as HELB. It's an organization. Now, under the Social Health Authority, we have the funds, yani pesa. So we have the fund for paying for you when you go to the smaller facilities. The smaller facilities are the dispensaries and the health centers and the sub-county hospitals. That's level 2, level 3, level 4. We call that primary health care fund. Under the Social Health Authority, we have another fund when you get an emergency in the road, you are having an accident or somebody has collapsed, you have to rush them to the hospital, the nearest hospital that you can get. So any emergency, we have a fund for that. And also for people who get what we call critical illness, you get into ICU. Because again, these are diseases that you cannot choose where to go. Whether I collapse here today, you will rush me to any nearest hospital. So we want to make sure that when any Kenyan is rushed to the nearest hospital, they can be paid for. Okay, you are perhaps unconscious. We have a lot of road traffic accidents. So we have emergency, chronic, critical illness fund. That's the second fund.
Yeah.
Then the third fund is you are sick, but you're not very sick, or you go to a hospital, the doctor has told you, okay, we can plan to do your surgery next month. So we have the social health insurance fund.
Now that's the shift.
That's the shift. So we have the primary health care fund, we have the emergency, chronic and critical illness fund, and then we have the social health insurance fund. Now the social health insurance fund pays for things that are not primary care, and they are not emergency or critical. There are things in between. You want a knee replacement. The doctor can tell you, oh, let's plan, we will do this surgery next month or next year. You have this problem, this your surgery is not an emergency, we can plan for it next year or this month. I have some growth here that has been, it's not painful, it's not disturbing me much, we can plan the surgery. So that is the social health insurance fund. Now, the first two funds, the primary health care fund and the emergency chronic critical illness fund, those ones are government paid funds. Okay. Because we don't want anyone to be discriminated. When you get an emergency, you go into a facility, unatibiwa. Anyone, whether you are a president or you are Oluga or you are a mama mboga, anyone, any Kenyan, is safe. That fund has been, we have 8 billion that the government has given us through parliament allocated just to pay for that fund. And soon you will see it will even be paying for ambulances. But we have to establish that ambulance system. Now, the primary health care fund, that is why the president said you walk in and you walk out of any dispensary, health center, and level 4 sub-county hospital. Because it pays for it. All the primary health care problems, that is the small problems. I have a small headache here, it's not an emergency, you have a homa. All public facilities, all private facilities, all faith-based facilities are level 2 and level 3. None should charge you. Now, at level 4, it is the public facilities, the outpatient, that now you don't pay. But if you go to a level 4 private, a level 4 faith-based, we still don't pay them with the primary health care fund. So we level 2, level 3. All hospitals, irrespective of whether it's a private or a
public.
Or a public.
Dr. Oluga,
and we have 13 billion for that.
For that.
That has been given.
There is an issue with SHIF that I've had a lot of people.
Yes.
NHIF, you needed to only pay for 3 months, and then you'll be able to access the services. Maybe you could clarify, because it's something I've had people complain about. You're supposed to pay upfront of a year, or what is happening? So
the Social Health Insurance Fund is the one that is contributory. Contributory means that we want you to pay something. So the government has put 21 billion. So we want you to meet us halfway, because we require 550 billion in this country so that we can make sure everyone is okay.
But paying it upfront now, for a common Kenyan.
Yes, so I'm coming to that. So this 550 billion, the insurances, the government budget, the county budget, if you add all of it, it comes around 300 billion. So that means that there's still a 250 billion gap. So we are trying to make everyone to meet us halfway. So how do people meet us halfway? If you are employed, the employer deducts. If you are not employed, but you have some income, we want you to contribute a little bit. Okay, just a little bit. That a little bit is determined by your status. The person who is selling tomatoes is very different from the boda rider. The boda rider may be getting like 1,000 or 500 shillings every day. okay? The person selling tomatoes may be getting 1,000 shillings every week. So they are very different. So we cannot just say the way NHIF said, all of us, everyone, 500 shillings. There are people who cannot afford 500 shillings. So we have to do a test. We have to try and measure, okay, what is your level of income? Okay, that's what we call means testing.
Means testing, yeah.
And it is a very simple thing. I know it has been complicated, but it's a very simple thing. It just asks you a set of very simple questions that you can answer. And if you are truthful, it just tells you, okay,
this is the amount of money.
This is the amount of money you're supposed to pay. And I know I'm coming to your question about whether you can pay it per year or not.
Yes.
Now, if you are employed, your employer has already given us the assurance because your employer is your agent.
Yes.
So your agent has already undertaken what we call undertaking.
Yeah.
So it has already undertaken that I will pay for Dr. Oluga. Okay?
Yes.
Now, if you are not employed, we need somebody to undertake. Okay? Because the problem we had with NHIF, which is again the problem we have had in the last 1 year of implementing a social health insurance fund, somebody goes to a hospital today because there's no more waiting time. You go to a hospital today, you pay 500 shillings, you get a surgery of 300,000, and then they no longer pay.
Yeah.
So now this 300,000 that the hospital needs to be paid because you got a surgery needs to come from somewhere. Now this somewhere means many of us should be contributing. Yeah. It's just the same as Harambe. I am sick today. I want to go to the hospital. My bill is 200,000. I have called my villagers to do an Harambe for me. Okay? Now the Harambe we have is the social health insurance fund. Okay? So now if we allow people that you pay 500 shillings, you consume a service of 200,000, it means that we will not be able to pay the hospital. Because somebody has only paid 500 shillings, but they want to consume 200,000. And then we are not even sure that they will pay next month.
Okay, so that's the reason.
So that is the reason. That is why it is in law. Actually, the MPs passed it 1 year ago in October 2023, what we call the Social Health Insurance Act. It is there, Section 35,
okay,
about that. But now, for the common citizen, we understand that the income may be irregular. We also understand that this income, apart from being irregular, may be little. Okay? So what we have done is to give options. That is the undertaking. The undertaking means that somebody who can stand in for you to say that, I am sure Dr. Oluga can pay 500 shillings every month. So what is that option? That option is what we call Lipa Sha Pole Pole.
Okay.
So now you dial *147#. You go to number 3, Lipa Pole Pole. It takes you through. I know people have been saying that, oh, you know, this is linked to Hustler Fund. Yes, it is linked to Hustler Fund. But there is no, it's not a loan. There is no interest, there is no cost. Hata ile cost ya M-Pesa, unajua ukituma M-Pesa 100 shillings, kuna 11 bob hapo katikati. Hii hata haina hiyo 11 bob. Hiyo 11 bob serikali imechukua. Imesema sisi kama Wakenya, kama unaweza lipa kidogo, lakini hauna hiyo pesa saa hizo, unaingia, unabonyeza *147#, unaenda kwa option ya 3, unaingia, unalipa ile pesa kidogo uko nayo ambayo ni miezi 4. Vile unasema hiyo NHIF watu walikuwa nalipa miezi 3. Sasa sisi tumesema usingoje kupata matibabu kwa sababu hiyo NHIF ulikuwa unangoja miezi 3. Hiyo miezi 3 umebleed, hata mtu amekufa, kansa imeenea. Sisi tumesema usingoje. Unalipa hiyo miezi 4. Unalipa hiyo miezi 4 alafu unapewa nafasi ya kulipa hizo zingine miezi 8 pole. Lakini kuna mtu amekusimamia.
Okay.
Hiyo tu hakuna shida kubwa hapo.
Okay, I think there was that confusion and people are like, okay, if it's supposed to be for the hustler, you know, 300 shillings, the minimum. But then if you say in 1 year, you know, in just 10 months, it's about 3,000. In a year, it's you know, 600. So that, I think that is where the confusion was. But even talking about that, government employees, or at least employees, for those people who are, are employed. So some of them actually, can I say, most of them pay twice, at least. Then you can have a private cover, and then you're still being deducted your, SHA.
Yeah.
You still have to pay that.
The shift,
You and the employer.
Yeah.
But again, government institutions have been known to be the biggest defaulters in terms
Actually,
of
now they are
remitting.
the most compliant.
Now they're most compliant. But we have people who still will go to hospital and not be able to use the shift.
Yes, for two reasons. One is that, the way the Social Health Authority...
Dr. Oluga, let me just cut you short. Let me go back to my colleague, that is Khalid Abdullahi, who is in the studio. Khalid Abdullahi, you could take it over from now, but we still continue with this interview. Definitely we'll be replaying it for you if at all you missed any part as from now, as we continue with Dr. Oluga in this conversation. Just touching on matters health, and right now talking about SHA, which I'm sure many Kenyans are concerned about. So Khalid Abdullahi, take it over from us.